In progress.
Hello.
Hello, how you doing?
I'm okay. How are you?
Doing pretty good.
Good. Good, 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 good.
I think we're all set here.
All right.
John, how you doing?
I'm good. How are you?
You good? All right. We got Corporation Counsel here.
Marilyn, how you doing? All right.
Pretty good, pretty good.
Good evening.
Hello, Attorney Osborne.
Good evening.
Hi, Director.
Good evening, Director. All right, we'll get started. Good evening, everyone. Thank you for joining our special virtual committee meeting for the Health and Human Services Committee for today, February 27th, 2025. My name is Councilman TJ Clark. I serve as the committee chair, and I'm joined by our majority leader, Malin Rossetti, who's a voting member, Attorney Councilman John Gale, who's a voting member as well. We have our Health and Human Services Director, Ebony Jackson Shahid here, and a host of guests. So we will begin with going out of order if my committee members don't mind to get the commission appointments first. We'll start with item 2.4, Mayor Arulampalam with the company resolution for the appointment of Lisa J. Herrera to the Commission on Refugee and Immigrant Affairs. And we have Lisa, who is here with us.
Hi, yes, thank you. I really appreciate you being able to do this out of order.
Thank you, Lisa. So can you just please tell us about yourself and why you're interested in being a member of the commission?
Yes, definitely. So I've been an immigration attorney for many years now. That has been my focus. So I've worked with many immigrants and refugee clients. I'm also an immigrant myself. I was born in El Salvador, and my family came from that country when I was very young. And so it's always played a role in my life, and I've always wanted to and been involved in any community work that involves refugees and immigrants. And so I'm currently an attorney at Greater Hartford Legal Aid, where I'm still doing immigration work. And through that work, I started getting involved with CREA just on a volunteer basis. And it's something that I've really enjoyed, and I want to become even more involved, especially, now that immigration laws in particular have been changing a lot. So that's about my interest.
Thank you. Any questions from my colleagues?
Well, through you, Mr. Chair, I'm like a broken record. Thank you, Attorney Herrera. I just always thank people because I know everybody's always busy and has so much more to do that you give of your time for something also that you have a passion for, that you obviously are connected with. And as a city person and council person, I really thank you for doing that, because without people like you, we wouldn't be able to do some of the things that we do. So thank you very much.
Thank you.
And let me, yes, thank you, Mr. Chair. And let me chime in to, with the exact same sentiment and add that I'm thrilled that apparently you are already familiar with CREA, and your familiarity hasn't driven you away. So that's a real testament to the fact that every now and then being involved in government can be pretty exciting and pretty fulfilling. And so good for you. And certainly, it appears that the next several years are going to be fairly trying times for our immigrant refugee communities. So any assistance is certainly going to be welcome. Thank you.
Thank you.
Thank you very much. I do echo the sentiments of my colleagues. Thank you for stepping up to the plate to help us out in this most important committee. You've seen what's been going on now in our nation, and so individuals like you that will be able to help out our residents here in the state of Hartford. If there are no other comments or questions, the chair will entertain a motion.
I make a motion to send back favorably the appointment of Attorney Lisa Herrera to the immigrants, what's the correct title? Refugee and Immigrants Affairs Commission.
Second.
Motion has been made and properly second to send this item back favorably to council. Is there any discussion? Hearing or seeing none, all in favor indicate by saying aye.
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 Ayes have it, unanimous. This item is passed. Next to be referred back to our city council meeting, next meeting. Thank you very much, Attorney Herrera.
Thank you.
Thank you. Thank you. I appreciate it.
Thank you.
We don't have Ms. Green here, so we will go that. All right, let's go back up to item 2.1. So item 2.1, Mayor Aralampalan with the company resolution to accept a grant of $1,376,327 from the Connecticut Department of Public Health, engagement with HIV and CVSTI related services. That was the HHS director.
Yes, how's everyone doing? Yeah, so this is the HIV, HCV, STI Prevention Services Program. So this is a Connecticut DPH grant, and it is for primarily for education and testing. We are the fiduciaries of this grant, and so we subcontract out with other organizations for the testing and linkage to care. So this is the prevention side of the Ryan White program. So we have Part A, we have Part B, and we also have this additional prevention grant for Ryan White.
Thank you, Director. Do you know how long we've been receiving this grant from DPH?
For prevention, this is a rather new grant. So I'd say probably within the last 3 years, we've been receiving the prevention portion of the grant. And I can get the exact time.
Okay,
Great.
that'll be great. And we have enough staff to help administer this prevention grant.
As of right now, we do. We're working on a program manager, though, for this particular grant. As of right now, there is an administrative assistant for prevention, but we are looking for a program manager.
Any questions from my colleagues?
Sure, Director. Kind of more of a general question. I know there's a grant and there's a third item, number 3 on our agenda is also a grant coming, in that case, I think, from the CDC. And I'm just wondering what kind of feedback you're hearing or what kind of information you may be getting, since there seems to be some degree of uncertainty coming out of Washington with respect to the future of, well, the future in general of grants. So I don't know how that relates to these types of health grants. I certainly hope that it doesn't impact them, but I'm just wondering what, if anything, you've been hearing.
So it most certainly does affect grants. It really depends on, I believe, if a grant is solely focusing on health equity, unfortunately, or anything related to what people perceive as DEI, or working with a specific community. Unfortunately, that community happens to be Black or Brown. And so we have been in communication with the federal government. And so that is with agencies at the with the CDC, as well as HRSA, and other organizations. We have not had um, really that much negative feedback. I mean, there was a freeze for a little while. So we really weren't able to draw down any funds for about 2 weeks. But then we got communication that we were able to do so. And that we would be okay with certain grants. Of course, we are now awaiting, really not so much on the federal level anymore, but some state grants that we may be in trouble with. And the state grants, only because some of the state grants get reimbursed by federal dollars. So those are the grants such as the immunization grant and the ELC 2 grant, which we are waiting to hear back on. But the grants today from Ryan White, so that's the HIV, HCV, STI, we are, good to go in business as usual as that. And also the other grant is also good to go. We have had to change some of our language for our subcontractors in our REACH grant, and that's because unfortunately it's specifically for the BIPOC community. So we've had to change any type of language or mention of health equity in our subcontracts.
Well, glad to hear that we're still getting the money though, and still being able to provide the services. So let's, I guess we just have to wait and see how it unfolds. Thank you. No
Thank
other
you.
question, Mr. Chair.
Thank you. The chair will entertain a motion.
I make a motion to send it back favorably to council.
Second,
Motion's been made and properly second to send this item back to council with a favorable recommendation. Any other discussions? Hearing and seeing none, all in favor indicate by saying aye.
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 Ayes have it. This item is passed. And we will take this up back at our next council meeting. Next item on our agenda, item 2.2, Mayor Arvelampian with a company resolution authorizing the city's Department of Health and Human Services to accept and distribute $500 in gift cards from the Granby Congregational Church. Madam Director, you are up again.
Yes, thank you. As you may know, the health department often gets donations. Those donation comes from community organizations, as well as faith-based organizations. These gift cards usually go to programs such as MyOp that do home visiting services, WIC, which we deal with families, women, infant, and children, and or our senior centers. So this is where our gift cards go to. So they go directly to residents.
Is there how is it distributed to residents? Is there a waiting list or?
So no, usually what we do is we keep them in a department, and depending on the situation, like if we have a renter's rebate, resident, and they need additional funding for, food or a specific item, then we may give them a gift card. If we have residents who are having a tough time and going through a relocation, right? They're fire victims, and they may need additional funding for an item, then we do have the gift cards available. So it really just depends on the situation or the program, but we use them in general for residents who, may be in a program, may not qualify for something, and, we are just trying to assist them to get through a tough time.
Thank you for the explanation. Councilwoman Rossetti.
Through you, Mr. Chair. Director, I'm just curious, and I know you said, we get from different, how do we thank these institutions who donate? I mean, I know the donation, they often say they don't, but do we have a formal way that we thank them with a letter or something?
I have not personally seen a letter that thanks any of the organizations, but usually when the organizations do a donation, it's usually like a photo op with the department, between the organization and the department heads or the program. It may be an event where the organization comes out and does some sort of photo op where they're either given a donation or a check. So that's usually what happens, but there is no formal,
Okay.
thank you.
So they are recognized. I guess, that's as an organization that gets donations, we always like to make sure people who do it want to know they're appreciated. So you're saying it's usually a photo op or something. So they're thanked there.
Yes.
Okay. Thank you. Thank you, Mr. Chair.
Have questions?
Just to follow up on that, Director, should you ever be at a loss for a way to thank any of these folks, I'm sure council would be happy to accommodate by providing, some manner of proclamation, and we routinely will bring people to a council meeting and present a proclamation to them in a fairly formal setting that I think most recipients like. So I'll throw that out there for you if you're ever needing a way to thank someone. I do have a question though. I'm just wondering, you're familiar with our internal audit department, and I know they routinely go around auditing different departments in the city and different programs. Do you know whether they've ever audited this type of program or this program specifically?
Honestly, if there are any audits done in any departments and there are donations, there are specific accounts that donations are in. Our donations are handled by our finance division. So they're not specifically handled just by employees, so, it's a protocol that we follow for giving out donations. So, when audits are done and it has to deal with donations, then that's usually from our financial division. But there is a protocol in place on how we pass out the donations.
Thank you. No other questions, Mr. Chair.
Chair, entertain a motion.
Be happy to make a motion to send this back to council with a favorable recommendation.
I second that.
Motion's been made and properly second to send this item back to council with a favorable recommendation. Are there any discussions? Hearing and seeing none, all in favor indicate by saying aye.
Aye.
Aye. Ayes have it. Item is passed back favorably, where we will take this up at our next city council meeting. Moving on. Item 2.3, Mayor Alanapola with the company resolution to accept approximately $1,900,000 in annual grant funding from the Centers for Disease Control and Prevention, CDC, for opioid funding. Madam Director.
Yes, so this is our OD2A grant, our Overdose Data to Action grant from the Center for Disease Control and Prevention, or the CDC. This is one of our largest grants. We are very excited about this program. We are working with 14 other municipalities and districts, and we are coming together to basically produce a standard of practice in data collection for OD2A information. Right now, I think a lot of the municipalities or districts in the greater Hartford area, they kind of do their own thing when it comes to opioid data. And so we're really trying to come up with a standardized way that we can all communicate and be able to have access to this data. So we're working not only with the municipalities, but we're also working with the state as well. There are many different components to this grant. So it's not just a data piece, but there is also a health equity piece, as well as education and training. We have not just municipalities, but other organizations such as AMR and various hospitals also, working with us, and harm reduction centers as well, on this grant. So very encompassing. I think it will be very rewarding, especially once we get to the evaluation stage, which is in a couple of years. But yeah, we're really excited about this.
Thank you. What struck me was the word that you used, health equity. In your comment earlier regarding the language change, how does this affect the executive order from the administration?
So this particular CDC officer that we have, they've made it very clear that we are to continue along with the original work plan. If any changes come up, they haven't been shy to let us know. But as of right now, we are continuing with the language. And in all of our contracts, we've been using the same verbiage. So as of right now, we haven't changed that. If we hear anything from the CDC in terms of what strategies to cut out, or if one of the strategies will be defunded if we use a particular language, then obviously we will change it. But as of right now, we're moving forward as planned.
Thank you. Is there a targeted area in the city that you're focusing more?
For Hartford, not really. I mean, I think that for us, it's really all of Hartford because it's more about how we are, how we're expressing information. So it doesn't really matter where the person is or individual that overdose, right? In the city of Hartford, it's just about how we interpret the data and how the data is shared. Right now, there are just many different ways to share opioid data. You have the police department, collecting data when it comes to opioid overdose, but in a certain capacity. And then you have the hospitals reporting on it differently. These pockets of information, agencies are not necessarily sharing with everyone. And then it makes it very difficult for agencies like the health department who do disease surveillance as a whole to not have the entire picture of the individual, right? So whatever the police is collecting, we might not have access to that, right? But the hospital, we may get a picture from the hospital on this individual's demise because they're just talking about reporting a death. So what we're trying to do is actually put it all together. But it doesn't matter where the individual is, from Hartford. So it's data is encompassing of everyone.
Questions or comments? Councilman?
Yeah, thank you. A couple of questions, Director. When you talk about harm reduction centers, does this include Mark Jenkins and his harm reduction center?
Yes, it does.
And you see, there was a second question here. Connecticut, as a state, has been involved in opioid litigation for many, many years, and I know that there's been some settlements that maybe we were participating in, maybe we're not, or maybe we're still holding out. So I don't know. But at some point in time, I believe there's supposed to be some money coming to the state from some of these from these lawsuits. Have you seen any of that money at this point, or is that still in litigation to your knowledge?
I'm not sure exactly what type of litigation or the name of these cases are at the state level. If you're talking about the opioid crisis funding, the city already receives that funding.
Well, I'm thinking about the Sackler family and they're in they've got this huge bankruptcy pending, and I know our attorney general was participating with other states, and then they turned down a potential settlement in that. So that's specifically what I was thinking about. Is this opioid crisis money coming from those lawsuits? Do you know?
No, to my knowledge, I don't believe that the opioid crisis funding is coming from that. I believe it's coming from the federal government. But what I do know is that this particular grant is totally outside of that. This is focused on data to action.
Thank you very much. Thank you, Mr. Chair.
Thank you, Councilman. Councilwoman Rossetti, do you have any questions?
No, I do not, Councilman. majority. What are you tonight? Oh my God, you're the chair. I can't remember.
All right, with that said, the chair will entertain a motion.
I make a motion to send back agenda item 2.3, prevention CDC funding favorably to council.
Second.
Motion's been made and properly second to send this item back to council with a favorable recommendation. Are there any other discussions? Hearing or seeing none, all in favor indicate by saying aye.
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 The ayes have it. This item is passed and will be taken up at our next council meeting. Our last item on our agenda is item 2.5, Mayor Awalapalam, with the company resolution confirming their appointment of Claudette and Graham to the Commission on Refugee and Immigrant Affairs, who is joined here tonight and is no stranger, because I believe she is currently serving on another board and commission. Ms. Graham, how are you?
Good evening, everyone. I'm doing fine. Thank you.
Thank you for joining us and thank you for signing up to take on another task to help us out in the city. If for those that are watching, can you just tell us a little bit about who you are and why you are looking to be appointed to this commission?
Sure. My name is Claudette Graham. I've been serving the city for many years. Been on the board of the West Indian Social Club as an education director, and I've served in other capacities throughout different organizations. I'm interested in becoming a commissioner with Sarah because the current climate, the current immigration climate calls for all hands on deck to deal with the situation that we're facing right now. And so Connecticut and Hartford in particular, we're a safe haven. And so we need to come up with policies and procedures and ways to help immigrants and refugees that will protect them, since we are all immigrants here. So Kristen has approached me to join, and I willingly say yes, because I think I can use my skill sets in any capacity to help to make this state and this city a place where immigrants will feel safe.
Thank you very much. Any questions or comments by my colleagues? Councilwoman Rossetti.
Through you, Mr. Chair. Thank you, Ms. Graham. As I say every time, and you serve in many years in multiple capacities. Thank you for giving your time. It just adds to the, all the work that we have to do, which unfortunately will probably even be more over the coming years. But thank you very much.
Thank you. You're welcome.
Councilman.
Sure, and Ms. Graham, John Gale, let me just add, second the sentiments there of Councilwoman Rossetti. Like her, like all of us, we're always very appreciative that other residents come forward and are willing to volunteer their time to serve on these very, very important commissions. And as you pointed out, this commission will have some added emphasis to its importance, given what's going on nationwide. So good luck with the commission, and know that the council is always here. If you in your discussions with the commission feel that there are ways in which city council can be helpful, by all means, get back in touch with any of us, and let's try to work together. Thank you.
Thank you, Mr. Dale. Thank you, Mr. Gale. Sorry. Thank you. Will do.
Thank you, Chair. Entertain a motion.
Move to send this back to council with a favorable recommendation.
I second that.
Motion's been made and properly second to send this item back to council with a favorable recommendation. Are there any discussions? Hearing or seeing none, all in favor indicate by saying aye.
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 The ayes have it. It's unanimous. The item is passed and will be sent back to council for our next meeting. Since we have no other business to discuss, this committee meeting is adjourned. Thank you very much for your time. Please continue to stay safe. With the increase of the norovirus, COVID, as well as the bird flu, a lot of our colleagues have been hit hard with the flu pandemic. So please stay covered up, stay masked up if you do so, get your flu shot and protect yourself. Until next time, thank you very much and have a good evening.
Thank
Quick
you.
note.
Thank you, guys. Good night.
Yes, sir.
Okay.
Quick note for you on the bright side of things, as I walked outside this morning to take my dog around the block, I saw popping up out of the ground a couple of little flowers called snowdrops. The little
Okay.
white flowers that pop up. So it's a sure sign that spring is coming.
Right around the corner.
Right around the
Right around.
Bye,
corner.
guys.
All right.
Thank you.
Have a good
all.
evening, everyone.
Have a
Thank you.
good
Night.
evening. Take care.
Good night.
Good night.